Hi friends, if you've ever been told that your labs are normal, but your brain just doesn't feel right, this number one vitamin deficiency may explain why. Let me tell you about an incredible dementia case that wasn't caused by aging. It was caused by missing one essential nutrient, cobalamin or vitamin B12, which most people assume they get enough of. However, did you know that 40% of the Western population may have low or borderline levels of vitamin B12? And this is a true story of what can happen when you don't have vitamin B12. This story, though, has a very happy ending. Now, throughout the story, I'll be sprinkling some great practical lessons everyone should know. And after the story, we're going to walk through exactly how you can get enough vitamin B12 to prevent this scenario from happening to you and your loved ones by understanding what food sources are rich in vitamin B12 and how to supplement when food and absorption fall short. And this is where the story becomes uncomfortably familiar. Ever struggle with a mood disorder despite taking several medications? That's what happened to this man. Let's call him Hani. That's not his real name. Hani was a 53-year-old man struggling with several mood disorders, depression, anger, anxiety, despite taking 3 heavy-duty psychiatric medications. So over the course of 2 months, his family noticed a marked personality change. He became more irritable, withdrawn, aggressive, and unable to sleep, which they initially just blamed on insomnia. Sleep deprivation is a form of torture, folks. So if that's you, then you know your personality will definitely change. You become more irritable and really tired. It was so bad that he needed a wheelchair to get around. Now things got even worse. He had to quit his job. His doctors assumed he had such severe mood disorders, and so they tried prescribing him 3 different psychiatric medications, but none of them worked. So then something changed that made it very clear this wasn't a psychiatric condition at all. One day, he couldn't stop vomiting, and finally, after 3 days, his family brought him into the emergency room. Now, FYI, if you're vomiting, don't wait 3 days to see a doctor. Like literally, that could have turned out really bad for Hani. Now, since this is a story about a vitamin B12 deficiency, I just want to make it clear, 3 days of vomiting will not get you vitamin B12 deficient. Something had to happen prior to that. Well, it turns out 3 months ago, he had a minor procedure for a biliary obstruction. Now, his doctors placed a biliary stent to open up his biliary tree so that his bile could flow. And by the way, bile is essential for you to absorb fat-soluble vitamins as well as fat. And when you have an obstruction, that's pretty painful and potentially life-threatening too. So most likely, you're not eating much during that time. However, 3 months is also simply not enough time to get you vitamin B12 deficient. It usually takes a couple of years unless there's something special that happens, such as bariatric surgery. You can become B12 deficient within months after bariatric surgery because it removes the acid as well as intrinsic factor. Both are needed to absorb B12. But Hani's biliary problem is a big clue something was off with his diet. And in case you didn't know, the health of your biliary tree is highly correlated with the history of your lifestyle. And so after further probing, it turns out Hani drank alcohol for 20 years. And he also ate a predominantly carb-heavy mixed diet. That's code word for ultra-processed food. Now, unfortunately, I don't know exactly what he ate, but usually if you're a heavy drinker, most likely you're not eating much food, if any at all. Carbohydrates are also not a good source of vitamin B12 because vitamin B12 is not made by any plants. Therefore, vegans and vegetarians, they have a higher risk of vitamin B12 deficiency unless they supplement. In fact, it's a must supplement if they don't eat any animal products. Before the discovery of vitamin B12, it was noted that vegetarians sometimes could cure themselves of really various severe symptoms like unable to get out of bed by eating beef and beef liver. And it turns out beef liver is a great source of vitamin B12 because that's how animals as well as people store our B12. And we'll talk more about food sources of vitamin B12 later. So on that day in the emergency room, after 3 days of vomiting, Hani's symptoms reached its peak. Remember, Hani was depressed, he was anxious, he was angry, he couldn't walk, he couldn't sleep, and now he couldn't talk. When he spoke, his words were incomprehensible. And literally, he could no longer filter his emotions, and he would have outbursts of crying. Ever show up in the ER and hear people screaming? They could have a preventable vitamin deficiency like Hani. Isn't that incredibly sad? Now, his doctors, they tried to stand him up, but he couldn't do it. And even when Hani was resting, he looked anxious with a resting tremor. They suspected that he had dementia, so they gave Hani a dementia test called a mini mental status exam, and he failed it. Obviously, if you can't talk, you're not going to pass that exam. So no matter how you slice it, Hani was not normal. And most likely, something was going on in his brain. Vomiting is a clear-cut sign that something is going on in your brain, that the brain is injured. It could be a sign of stroke. Your brain and your brainstem controls your balance, nausea, automatic reflexes. So when you have injury to this pathway, then you can vomit. And sure enough, they got a brain MRI that he had diffuse brain changes with chronic white matter ischemia. That means he had a great deal of his brain that died. Now, luckily for Hani, his symptoms were so complex that he got a neurologist who checked a vitamin B12 level. And it turned out he was severely deficient. So they replaced his B12, and after 6 months of methylcobalamin replacement, Hani, we learned how to talk, how to walk, he could drive a car, he could pass the mini mental status exam with a perfect score. So this is an example of reversible dementia caused by one single vitamin deficiency, vitamin B12. That's pretty sad. That really shouldn't have happened in America, the wealthiest nation on the planet with the most expensive healthcare costs. Ironically, vitamin B12 is dirt cheap and over the counter. So if you know anybody eating a restrictive diet, anybody who's struggling with memory, issues with nerve problems, aches and pains, weakness, vitamin B12 is worth checking. But checking vitamin B12 status is more nuanced than ordering a blood level of vitamin B12. A serum vitamin B12 number can sometimes be misleading when it's low normal because neurological deficiency can occur even when your levels fall in the normal range. So a compound called methylmalonic acid, MMA, it actually rises when B12 dependent enzymes are impaired. Elevated MMA is one of the most sensitive indicators of true vitamin B12 deficiency. Homocysteine is another helpful marker, as B12 is required for its metabolism. When B12 is low, homocysteine levels increase, contributing to vascular and cognitive risks like strokes. So in practice, a normal serum B12 with an elevated MMA or elevated homocysteine is very suggestive that the person has a functional B12 deficiency that still warrants attention. And this is exactly why relying on just one value, a serum B12 alone, can miss early or neurologically significant deficiency, and why a more complete evaluation is especially important in people with nerve symptoms like cognitive symptoms, neuropathy, and anemia of unclear cause. Other people at risk are people with long-term use of certain medications that impair absorption, and you may want to stick around to hear that list. There are actually quite a few. Unlike other essential vitamins, cobalamin, or vitamin B12, doesn't behave like vitamin C or B1 or folate, which needs constant replenishment. You need to eat that on a daily basis. And like I mentioned, your liver can store several years' worth of vitamin B12. That's why deficiency often sneaks up quietly. There's no dramatic crash until something dramatic happens. And instead, there's usually a slow unraveling. And clinically, this is why people can go for years absorbing suboptimal B12 levels, or even taking medications that block absorption entirely without obvious symptoms. And there's so many foods that have no B12 on the market. So if you have a restrictive diet, or if you don't eat any animal products or animals at all, then you have a B12 deficient diet. And vegans and vegetarians, they need to supplement. Otherwise, it puts you at higher risk of stroke. But the thing is, the animals actually don't make B12 either. B12 is only made by germs or microbes. So if you're eating an ultra-processed food diet, you're eating a B12 deficient diet. Now, animals accumulate B12 through eating microbes. They basically eat dirty food contaminated with bacteria. The other way they can get it is their own gut microbes can actually make some. And like I said, if you're a vegetarian, you got to look for other sources. And the richest vegetarian source of vitamin B12 is probably nutritional yeast. But you have to eat a lot of it, and it has to be actually fortified. So it's not a reliable source of vitamin B12. Technically, fermented foods can have a little bit of B12, but they are also not reliable sources to get people adequate. So the richest vitamin B12 source are animals. Clams, liver, sardines, salmon, beef, dairy, and eggs. However, the nuance that rarely gets discussed is having an adequate amount of B12 in your food does not guarantee that your body can extract it and absorb it. Food-bound B12 first must be released by stomach acid and enzymes before it can bind to intrinsic factor. So this is where your age, your medications, and your gut health completely change the equation on just eating enough foodborne B12. And we'll talk about that later.
Hi, friends. I am so thrilled that you want to take charge of your health and take charge of your food. Now, I know nutrition can be complex, but it doesn't have to be. And I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in my show notes, and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video now.
But when you get vitamin B12 deficient, first your nervous system starts misfiring. Then your red blood cell production becomes abnormal. DNA synthesis slows down. Literally, your entire body starts falling apart. And suddenly, the symptoms seem unrelated. You get fatigue, numbness, depression, balance problems, memory loss. Like, all these are classic symptoms that Hanny suffered that was unrecognized. This delayed onset exactly what makes cobalamin deficiency or vitamin B12 deficiency so dangerous. By the time symptoms show up where people are pretty suspicious, damage is already advanced. However, most medical doctors would recognize anemia caused by vitamin B12 because it causes a very classic anemia called megaloblastic anemia. But here's the unsettling part. Many people actually present first with neurological symptoms, and they don't have the anemia at all. In fact, vitamin B12 deficiency is known as a great masquerader. It can cause abnormal symptoms, chronic diarrhea, swollen red painful feet, darkening skin, and Parkinson's-like symptoms, and of course, many of the neurological symptoms that Hanny suffered from. And doesn't B12 sound super important? And this is why. Cobalamin sits at the center of two critical biochemical reactions for life. One involves methylation, which affects DNA repair, neurotransmitter production, and gene expression. Now, the other is essential for fatty acid metabolism in nerve cells. So your nerves only work because all of them are covered with fat that insulates your nerves to allow electricity to move. Think of your nerves as electrical wires. What happens when you strip the plastic off the wires and then you try to turn the light switch on? You think your bulb is going to go out, or is it going to short circuit? And are you going to burn something, right? Because electricity is going to maybe cause a fire elsewhere. That's essentially what will happen when you remove myelin. Vitamin B12 deficiency causes a lot of misfiring in your house and potentially can take it down like it did Hani. But before your body absolutely collapses, you will have warning signs. When you have low vitamin B12, the myelin, the protective coating around your nerves, it begins to degrade. And this is why people describe tingling, numbness, burning, and an unsteady gait. The nerves furthest away from your body often get affected first, like your feet and your legs. And in your brain, you have impaired methylation. That affects your memory, your mood, and executive function, your logic. And clinically, this is why vitamin B12 deficiency can look like depression, dementia, peripheral neuropathy, or even Parkinson's. And it's also why misdiagnosis is so common. You know, when you present with failing memory, you often get labeled with Alzheimer's disease. The good news is some of these symptoms could potentially be reversible if you give the person vitamin B12 on time. And this is why early awareness matters. However, simply eating animal meat may not be enough. Remember, you have to absorb cobalamin with the food, and you need an adequate amount of stomach acid, a functioning pancreas, intact intrinsic factor from your stomach, and a healthy terminal ileum. That's a lot of body parts. As people age, stomach acid naturally declines. Conditions like gastritis, gastric bypass, H. pylori infection, as well as inflammatory bowel disease and autoimmune atrophic gastritis can all further impair B12 levels. And to sum it up, there are three groups of people at risk of B12 deficiency. The first are people on a restrictive diet, specifically people who don't eat any animal or animal products, whether that's eating highly processed food or being strictly vegan or vegetarian. The second group of people have stomach or bowel problems. They have absorption issues, or they've had surgery, or they take medications that interfere with acid secretion or the intrinsic factor protein. The third are basically 100 million Americans that are older than 50. And if you're in any of these groups, it's important that you take a supplement rather than rely on fortified foods or natural foods. And yet, almost no one is told this for routine care. And there's a unique advantage about supplements that I'll explain a little later. So now let's talk about drugs, because this is where the clinical stories, they start multiplying. Now remember how Hani, he drank alcohol for over 20 years? Alcohol is well known to reduce absorption and storage of vitamin B12. Other drugs that interfere with your gut absorption are proton pump inhibitors, H2 blockers. They reduce your stomach acid. Therefore, it impairs B12 from being released from your food. Are you on metformin? That's one of the most commonly prescribed diabetes, pre-diabetes drugs in the world. Did you know that metformin interferes with the calcium-dependent B12 absorption in the ileum? That's your small intestine. So that means if you're taking metformin, you're not going to be absorbing the same amount of B12 in your foods. It is well known that long-term use of metformin is strongly associated with lower B12 levels. Yet routine monitoring that may not be done. Clinically, this may show up later as neuropathy or cognitive decline that gets blamed for diabetes and aging rather than the medication itself. This is actually a predictable outcome. So if you or someone you love takes acid-blocking medications or metformin, then this part alone should change how you view normal labs and how you should be supplementing for your vitamin B12. There are other gastrointestinal drugs and seizure drugs that can reduce your levels of vitamin B12. And when your absorption from food is impaired, lots of times supplements can bypass that digestive process. So oral crystalline vitamin B12 does not require stomach acid to be released from protein because it's not in food form. High-dose oral supplementation often works for many people, even without intrinsic factor, because a small percentage of vitamin B12 is actually absorbed passively. Sublingual forms may help some individuals, and the dose may matter more than the route. And now in clinical practice, injections are reserved for severe deficiency, neurological symptoms, or malabsorption syndromes. So the key is not just taking B12, but reassessing levels, symptoms, and underlying causes. And supplementation without addressing medications or your gut health, that's often incomplete. And if you do nothing, you will lose about 1 micrograms of vitamin B12 per day. The USRDA recommends 2.4 micrograms per day. The thing is, only about half of dietary amounts are absorbed, and theoretically, an intake of roughly 2 micrograms would replace the losses for an average person. Now, to cover nearly the entire population rather than just half, this amount is increased by about 20 to 40%, which is how the USRDA got the 2.5 micrograms per day. However, even that amount may not be adequate to fully normalize markers like methylmalonic acid, MMA, and homocysteine when you are depleted. Studies suggest maximal benefit occurs at intakes closer to 4 to 7 micrograms per day, higher than the RDA. And because only about 50% of the small dietary doses are absorbed, this really translates to absorbing roughly 2 to 3.5 micrograms daily. Now, with fortified foods, this can be achieved by consuming small amounts of multiple meals. And if you're going to supplement, absorption follows a different pattern. Only about 1% of very large doses is absorbed, which is why either 50 micrograms daily or 2,000 micrograms per week both work equally well in practice and have been shown to normalize MMA and homocysteine levels. So either or both fortified foods and supplements can meet people's daily needs effectively when dosed with absorption in mind. So how should you take it? Well, like I said, orally, sublingually, or you have to find a doctor for injections. Oral vitamin B12 supplementation, even in people with impaired absorption, it has been shown to be effective as injections when you take a high enough dose. And typically that's 1,000 micrograms daily for 1 to 4 months, and depending on your baseline deficiency. And it's important to follow it up with a lower maintenance dose. Now, there are several forms over the counter. Cyanocobalamin, that's the most stable, well-studied, and reliable option for oral supplementation. Lots of people don't like the cyano component, so then you can take the methylcobalamin. The absorption is significantly improved when B12 is taken as a chewable, sublingual, or a liquid form, so it has a chance to mix in your saliva with salivary proteins for transport. And simply swallowing tablets could fall short in some individuals. High blood levels of vitamin B12, that's sometimes associated with increased mortality, but that evidence really strongly reflects, I think, the food form as opposed to B12 itself. Now, elevated serum B12 can occur when your tissue is damaged, and then you have a lack of clearance when you have cancer, liver disease, or kidney disease, or some other systemic illness. However, when the diseases are treated, so like let's say cancer is treated, your tumor burden decreases, that B12 level will start falling. And that indicates that illnesses that drive higher B12 level can be causing the higher mortality as opposed to higher B12 levels by itself. And when you really look into the details, high vitamin B12 supplements are not associated with increased mortality. However, the form of the B12 that you get are foods such as meat, dairy, and eggs. They simply have a higher cardiovascular mortality linked to obesity and diabetes, increasing your mortality. So it's really more the animal products as opposed to B12 itself. And long-term studies do not show a problem with high pharmacological doses of B12. Really, there is no known tolerable upper limit because it hasn't been shown to be toxic. Excess B12 really is poorly absorbed and readily excreted. Because taking B12 and absorbing it are two different stories, remember? And that can vary between individuals based on their biology and what else they're doing. There's actually a greater risk of underdosing rather than overdosing. And remember, your absorption can be improved when you take B12 on an empty stomach and spread it throughout the day in between meals. Smaller doses are probably a safer strategy than bolusing it. If you remember one thing from this video, remember this: aging does not cause B12 deficiency, and dementia could be reversible if you can correct the damage before it is permanent. But really, for the brain to work properly, you need more than B12. You actually need vitamin B1. And to learn more about that, watch the next video.